Colleagues, I'm happy to speak to you on the occasion of the World Mental Health Day. Mental health and disorders are widely recognized now as a huge unrecognized burden in the global burden of disease. And they impact child health in its wider definition, including school-age children and adolescents, in manners that we are only just beginning to recognize. So not only do we know that mental health disorders underlie a number of suicidal behaviors in young adolescents, but also underlie a significant proportion of the burden of disease. And almost half of all mental health disorders actually start before 14 years of age. So the importance of their recognition in the context of the daily lives and works of pediatricians, as well as from a public health recognition and prevention perspective, are being increasingly recognized. So in the era of sustainable development goals, what that means is there has to be much closer integration between education system, the health system, between practitioners who need to have greater sensitivity to these problems, and community services, including the social safety nets, to recognize mental health issues ranging from depression to serious disorders, and with many of these having their origins in learning disorders in childhood. We, as the International Pediatric Association, are committed to making sure that these things become not only ancillary activities of pediatricians as we struggle with reducing child mortality, but also part of our core as we address this emerging issue in the context of the health and well-being of children and their families. What that requires is that there need to be systems in place for ensuring that we have adequate screening in our school health programs and also in our family health programs. What it also means is there has to be adequate training for pediatricians as part of their residency programs and as part of their postgraduate training programs in the basics of mental health disorders in children and adolescents. What it also means is that there needs to be inclusion in terms of outreach programs for pediatricians in families and communities where they are dealing with mental health issues that may relate to environmental factors. A major chunk of our work now globally is also in conflict settings and humanitarian emergencies, and therefore recognizing the burden of mental health problems in that proportion of the populations that are exposed to unspeakable violence and unspeakable atrocities being witnessed in their environments, particularly in conflict settings, that also becomes an imperative for pediatric associations and pediatricians. So I'm calling upon you on this World Mental Health Day to increase the awareness of this problem in your daily work and in the work of your societies and associations, and to ensure that we build on the evidence base in terms of strengthening our own capacities and in building the response strategies for resilience in populations where these things are being recognized as an important contributor to the burden of disease and ill health. And our best wishes to you in this endeavor in which the IPA, the International Pediatric Association, commits to make sure that you have the tools and the advocacy materials available to you to make your task easier in the years to come. Thank you.